Nurses in Ontario aren't just saying it, they've put it in writing. They are struggling to properly care for patients. A new survey from the Registered Practical Nurses Association of Ontario finds that 91% of nurses say patient care, that's the care of you and I, is being compromised by staffing shortages. That situation is leading to 48% of respondents considering quitting nursing altogether. For more this morning, we are joined by Dianne Martin, CEO of the Registered Practical Nurses Association of Ontario. Great to have you here.
Thanks, Anne-Marie.
So this report has nurses sharing challenges that range from struggling financially to experiencing what's described as moral distress. What are nurses telling you?
So nurses are telling us that their experiences have sort of leveled off in terms of the shortage, but they've leveled off at a very difficult level. And they go to work every day with the intent to do a great job, and they come home every day feeling like they've failed, purely because of the short staffing situation where they have to pick and choose what kind of care, the most necessary care for them to provide, and it's really taking a toll.
I was speaking with one nurse recently who described it this way. She said she feels like patients are receiving substandard care right across the country because of the staffing shortages that they're experiencing, not because of lack of will to work, but because there's just not enough people to do the jobs that need to be done. Is that what you're hearing as well?
Oh, yes. Yes. What we're hearing is that it's quite similar across all of the provinces. Ontario had a little bit of a more difficult situation in some ways when Bill 124 was in place, so that as the workload was ramping up so significantly, their pay levels were kept low, especially practical nurses, whose pay level is significantly lower than that of registered nurses, although the roles are quite a bit closer together.
Let's dive into something that was new to me, but your report talks about it quite a bit. And this is the effect of agency nurses on workplace culture.
Yeah.
That's something in the report. What are nursing agencies, and why is the province using them?
So nursing agencies are groups, for-profit groups that people can hire staff through in a crisis. And nurses go there, you can't blame them, they go there because they can make a lot more money. It means that when organizations hire agency nurses in, they're hiring them in at 2 to 3 times the pay that they would pay, that they are paying the nurses who work on staff. And those nurses now need to work side by side. The nurses who know the units, know the patients, know the routines, are teaching these agency nurses how to do work within that environment. And the agency nurses are making significantly more money. And it's a very difficult situation for nurses who are on staff in organizations.
So we are paying more to nurses outside of the province than we are paying to the nurses who have stayed in with the provincial healthcare system.
So, no, the nurses who have stayed employed directly by the employers, and other nurses who have left their jobs to work for an Ontario agency and then get paid more to go into sometimes the same place they used to work.
The Ontario government has said it has registered more than 32,000 nurses since the summer of 2022. But your report says the province's figures are missing important context. What is that?
So the province is giving us regularly numbers of nurses who have been newly registered, but they don't subtract for you the number of nurses who've left the profession. So if you look at registered practical nurses, for example, yes, they graduated about 6,000 during the past year alone, but we have a net minus 400. So at a time when our aging population is going to need more and more care, and we need to add tens of thousands new nurses, we're actually experiencing in practical nurses a negative number during the past year.
We did reach out to the Ontario government. A spokesperson sent us this statement. It reads, in part, through our government's health plan, we have broken down barriers for internationally educated healthcare workers while allowing healthcare workers registered in other provinces and territories to immediately start working in Ontario. Removing financial barriers for nurses wanting to upskill and expand the Learn and Stay grant to provide eligible students in nursing with funding for tuition, books, and other costs. What's your response to this?
Internationally educated nurses Absolutely a gift to all of us, really thankful for those nurses. As far as the nurses being able to move into our province from other provinces, we can also move into those other provinces quite easily. So it's kind of people are moving where they want to move. The education piece is important. If nurses feel they have a bright future and can have support, financial support through education to move through and this profession to a different level, they will choose to stay in this profession. So that is an important thing that the government is doing.
Listen, we listened to our nurses during the pandemic, especially. We should continue to listen to them now that we are out of it. And when they say there is a crisis happening, pay close attention. Dianne Martin, thanks for joining us.
Thank you so much.